Dr. Tyna Moore, a naturopathic physician, discusses her perspective on GLP-1 agonist medications like Ozempic and semaglutide. She became interested in these drugs, which she refers to as peptides, when researching them for a podcast episode. Dr. Moore discovered that beyond their well-known effects on weight loss and diabetes management, these peptides have potential benefits for neuroregeneration, pain reduction, and other health issues. This piqued her interest as it aligned with her background in regenerative medicine. She began using compounded versions at low doses on herself, family members, and patients, observing significant positive results across various health conditions. Dr. Moore addresses several misconceptions about GLP-1 agonists. She argues that concerns about muscle mass loss are overblown, stating that any lean mass loss is comparable to other calorie-restricted diets and bariatric surgery. She notes that lean mass includes more than just muscle, so reported losses may include reductions in fatty infiltrates in organs. Regarding thyroid cancer risk, she explains that studies showing increased risk are correlative, not causative, and the original black box warning was based on rat studies that may not translate well to humans. She also contends that reports of severe gastroparesis are often sensationalized, as gastrointestinal motility typically returns to normal after discontinuing the medication. While acknowledging the drug's effectiveness for weight loss and diabetes management, Dr. Moore emphasizes their potential benefits in other areas. She has observed improvements in cognitive function, pain reduction, mood, and autoimmune symptoms in herself and patients. She notes that many of these benefits appear to be independent of weight loss. She cites recent studies showing cardiovascular benefits in overweight individuals that persisted even when controlling for weight loss. She believes these peptides may have regenerative and anti-inflammatory properties that could benefit a wide range of health conditions. Dr. Moore advocates for a low and slow approach to dosing GLP-1 agonists. She primarily uses compounded versions, which allow for more precise and lower dosing than commercially available options. She argues that many side effects reported with these medications are due to overly aggressive dosing. By starting with very low doses and gradually increasing as needed, she reports that most of her patients avoid common side effects like nausea and vomiting. She views these peptides as tools to be used in conjunction with lifestyle modifications, not as standalone solutions. She emphasizes the importance of personalized treatment plans and close monitoring by knowledgeable healthcare providers. Dr. Moore places the discussion of GLP-1 agonists in the broader context of declining metabolic health in society. She cites statistics showing that the vast majority of American adults have some degree of metabolic dysfunction. She sees this as a crisis driving numerous health issues, including fertility problems and poor outcomes during the COVID-19 pandemic. She argues that intervening earlier in the progression of metabolic dysfunction, potentially using tools like GLP-1 agonists, could have significant positive impacts on public health. However, she stresses that these medications should be part of a comprehensive approach, including diet, exercise, and other lifestyle factors. Dr. Moore shares her personal experience using GLP-1 agonists, describing improvements in cognitive function, mood, and autoimmune symptoms. She also discusses positive outcomes in family members, including her father, who has experienced significant weight loss and improved quality of life, her mother, who has seen reductions in Crohn's disease symptoms, and her daughter, who has had improvements in PCOS and mental health. In her clinical practice, she reports using these peptides for a variety of conditions beyond weight loss, often at very low doses. She emphasizes the importance of individualized treatment plans and monitoring for each patient. While generally positive about the potential of GLP-1 agonists, Dr. Moore acknowledges several concerns. She worries about the potential for misuse or overuse, particularly at high doses without proper medical supervision. She cautions that long-term use at high doses could lead to receptor desensitization, potentially reducing the medication's effectiveness over time. She also expresses concern about people using these drugs without making necessary lifestyle changes, potentially leading to muscle loss and nutritional deficiencies. She stresses the importance of using these medications as part of a comprehensive health plan, not as a standalone solution. The conversation touches on broader societal issues related to metabolic health and obesity. Dr. Moore discusses the challenges of implementing large-scale public health interventions in the United States, citing cultural resistance to government involvement in personal health decisions. She contrasts this with approaches taken in other countries, such as Japan's national response to a small increase in obesity rates. While acknowledging the need for systemic changes, she argues that tools like GLP-1 agonists can play a valuable role in addressing immediate health crises while longer-term solutions are developed. A significant portion of the discussion focuses on the importance of education and patient empowerment. Dr. Moore has created educational resources, including a free video series and a more comprehensive course to help both patients and healthcare providers understand the potential benefits and proper use of GLP-1 agonists. She emphasizes the importance of patients being well-informed and actively involved in their treatment decisions. She encourages people to seek out knowledgeable healthcare providers who are open to discussing these medications and willing to consider low-dose, personalized approaches. Dr. Moore expresses optimism about the future of GLP-1 agonist medications, predicting that more options will become available and prices will likely decrease due to competition. She anticipates ongoing research will continue to uncover new potential applications for these peptides. However, she also stresses the need for more long-term studies on the effects of prolonged use, particularly at lower doses. She hopes to see more research into the mechanisms behind the various benefits observed with these medications, beyond their effects on weight and blood sugar. Throughout the discussion, Dr. Moore strikes a balance between enthusiasm for the potential of GLP-1 agonists and caution about their proper use. She sees these medications as valuable tools that, when used appropriately, can help address serious health issues and quality of life for many people. However, she repeatedly emphasizes the importance of using them as part of a comprehensive approach to health, not as magic bullets. She advocates for a nuanced, individualized approach to treatment that considers each patient's unique circumstances and health goals. An interesting point raised by Dr. Moore is the potential for GLP-1 agonists to enhance neuroplasticity, potentially making it easier for patients to adopt and maintain healthy lifestyle changes. She suggests that the period while patients are on these medications provides a window of opportunity to establish new habits and rewire the brain's reward circuits. This perspective frames the use of GLP-1 agonists not just as a treatment in itself, but as a tool to facilitate long-term behavioral changes that can lead to sustained health improvements. Dr. Moore acknowledges and responds to various criticisms of GLP-1 agonist use, including concerns about long-term effects, potential for abuse, and the argument that they represent a lazy approach to weight loss. She emphasizes the importance of addressing root causes of metabolic dysfunction, but argues that these medications can be valuable tools in that process. She also discusses the controversy surrounding the use of these drugs in children and adolescents, advocating for careful consideration and close monitoring in such cases. The discussion concludes with Dr. Moore encouraging listeners to educate themselves about GLP-1 agonists and metabolic health in general. She directs people to her various educational resources and emphasizes the importance of working with knowledgeable healthcare providers. She frames the current metabolic health crisis as an urgent issue requiring immediate action, while also acknowledging the need for longer-term societal changes. She expresses hope that by combining tools like GLP-1 agonists with comprehensive lifestyle approaches, significant improvements in public health can be achieved.